Morning, everybody. My name is Crystal Budd, and I am with Health Plans for Less. I've been doing health insurance, life insurance, and Medicare for about 20 years now. So I've been in the industry and seen it change over the years. The most significant change has been when Obamacare came into effect. And so I printed out for you this morning a sheet that says covered California plans.
On the first
When
page,
the changes occurred,
second up will be Murray.
they restructured plans to make it easier for people to compare. Previous to covered California or the Obamacare coming out, health insurance has and had many moving parts. And so for a lot of people, it was really difficult to compare one plan against another plan. So when the federal government came in and restructured healthcare, they decided they would try to simplify it for people to understand it. So what they did is they created these metal tiers. They have bronze, silver, gold, and platinum. And logically, bronze would be your least expensive plan, platinum would be your most expensive. So that's kind of a, natural thought process, right? Okay, bronze plan's going to cost me less money, platinum more expensive. So when you look at the plans on here, again, this is just a sheet from Covered California for 2022. Okay? These are what they consider on exchange. And on exchange just means I'm purchasing a plan through Covered California because I'm eligible for a subsidy, meaning that someone else, the federal government and the state, is going to help pay your health insurance. That's what a subsidy is. Just so you understand, I am certified to do Covered California as well. And I have been since the very beginning when the transformation took place, when they changed everything. So there's off exchange for people that do not qualify for a subsidy. Many of you in here don't qualify for a subsidy. Subsidy means you are lower income. But if they have continued to raise the poverty thresholds, so more and more people are qualifying for subsidies today than they were before when they initially instituted the program. So again, when I talk to people, it used to be I'd have to interview them about their health questions. Today, it's no longer about, are you insurable? Do you have a pre-existing condition? Anybody can get health insurance today. Okay, there's no reason. If you don't have it, it's because you're choosing not to have it. Nobody's going to take it from you. So I don't care if have 3 different illnesses and you're very sick and you're spending $10,000 a week. It doesn't matter. You're eligible for health insurance. Okay. So it's just a matter of, are you willing to pay the premiums to have the policy that's available to you? If you are lower income, you will qualify for a subsidy. And that, I've seen people pay $1 a month because their level of income warrants that kind of help. All right? So it's really important that you talk to a professional that can walk you through the process to see if you want to be part of that program. I have had people that they're on the threshold of getting $20 a month, and they decide they don't want to do it because they don't want the extra protocol and paperwork to go through Covered California. When you sign up for Covered California, you have to reveal everything they ask of you financially. It's no longer about the health questions, it's about the financial questions. And some people are very private and they do not want to give that up. And that is your prerogative. But you will not get a subsidy without providing all the necessary information that they're asking, right? When they change the thresholds for household income, meaning the poverty level, when that is changed, it changes every year, what happens is it may take somebody that's on that very low income and now kick them into Medi-Cal. And that has happened to some of my clients. They're like, but I didn't ask to get into Medi-Cal. Well, I don't have anything to say so on that. These are all government thresholds. So if you don't meet the minimums of what is required, you will go automatically into Medi-Cal. And then that is run by the state of California. That is not something that I'm involved in, okay? So health insurance, when you're looking at a plan, most people are gonna buy one of two plans. They're gonna buy a bronze plan because they're healthy, they wanna be covered for catastrophic purposes. The bronze plan's requirements by the federal government say you must cover preventative, which, and some at first initial doctor visits, like you might get 3 doctor visits set for the primary care physician. You'll have urgent care, and you're going to have your physicals, your flu shots, your immunizations, your COVID. All that's going to be covered, okay? Everything else is going to fall subject to co-insurance and deductibles and max out-of-pockets. That might, some of you might think, what does all that mean? You want to talk about it? See me later. Okay, we'll talk about all those the words and what they mean. But so the bronze plan makes sense for most people. I've even had it where they do have another option in the bronze category. It's called the health savings account, HSA. HSA makes sense for people, let's say they take a lot of medication and it's very expensive, $1,000 a month. You have an HSA, you are paying all of the costs up front initially, pre-tax dollars, and you max it out quickly. Let's say your maximum is $6,800, then they pick up 100%. Well, if you know you're going to spend $1,000 in medications, no matter what you do, then it may make sense to buy an HSA, get paid pre-tax dollars, max it out quickly, then they pick up 100% for the rest of the year. So it's all about dollars and cents. If you were going to buy that plan on your own, you would never think to buy that. You would think to buy a plan that's I'm going to have a $30 copay for my drugs, a $50 copay or $90 copay. So when we look at that, I'm always asking people, how do you use your plan? Where are you spending your money? What's important to you? What doctors do you have to keep? What hospital do you want to go to? Some people say, I've never go to the doctor, ever. And I'm like, well, obviously you're a bronze candidate, but I've got to go to Hoag. Okay, well, that knocks out multiple plans. I already know they don't take Hoag, right? So I'm always thinking, how can I best serve them based upon what they want? So anytime you transition from one health plan to another, you usually have to give up something. Because in the environment with Obamacare, it changed the network structures completely on the individual purchasing side. So that means that the networks are smaller. They're trying to get cost savings for you and everybody else because they have to cover more. They have to cover unlimited. It used to be, 1 million, 2 million. Now it's unlimited care. So they have to offer preventative. They have to offer maternity. They have to offer counseling. They have to offer so many things that weren't required on these policies before. So the costs have gone up. That's just the way it is. Preventative is not, it's free to everybody. We used to have, we had to pay for mammograms and pap smears. Now we don't have to do that. It's all covered. So that's why when you see your premiums going up, that's why your premiums have gone up. It's because they're now required to cover all of these additional benefits. Okay? You can't pick and choose. I used to buy a non-maternity policy. That doesn't exist today. Every policy has maternity on it, whether you need it or not. So you and I are pulling on the same rope. We're all sharing in that cost, okay? So it's really important. So if you're looking at these Covered California plans, again, you can buy these on Covered California. You can buy them off exchange or independently through the carrier. So depending upon if you get a subsidy, that's all Covered California is. They're not an insurance company. They're the entity. Let me make this clear because people are really confused about this. They're just the entity that determines if you are eligible for a subsidy. And then they will validate that, and then they will they will send the information to the government, to the state and the feds, and they will help pay the insurance company that subsidy that you don't have to pay. That's all Covered California is. They're not the insurance company. So you contract through Covered California for Blue Cross, Blue Shield, Health Net, whomever it is, Kaiser. And I represent all the plans in California, and I'm not partial to any one of them. I'm only partial to what meets your needs and what's important to you, because I don't know what's important to you. You may have a doctor that you say, I've got 5 doctors, but I only need to make sure I keep 2 of them. Because of the environment we're in, the likelihood of you getting all 5 is very slim. I'm just being honest. Unless you want to pay a lot more money per month. I can get you a plan that has all those doctors, but you're going to pay a lot more, maybe 20 to 30% more, because the networks have changed. Now, in the small group environment, the networks haven't really changed. Obamacare never really transitioned into the small group market. So the networks are vaster, you have a lot more options, you have a lot more deductible choices. Plans sometimes are more expensive, sometimes they're not. I went and saved a company $35,000 a year. I requoted their insurance. They couldn't believe it, and it's better coverage. But I worked really, really hard. And I put together an option of 3 different carriers and go through a special, unique option. But I've made it work for them. And they had a bigger group. So they had a lot higher needs than a group of 2 or 4 or 10, right? You got 30 people, it's a lot more needs to fill. So anyway, I show you this because the silver is the most probably purchased plan. And the reason why the silver plans are the most purchased plans is because they have first dollar coverages that don't apply to deductible. For example, if you look down on the silver plan, you're going to see you don't pay for your annual visit. That's free to your physical. Primaries are 35, urgent are 35, specialists are 70, emergency room 400, labs are 40, x-rays are 85, any diagnostic like MRIs, PET scans, C-scans, CAT scans are $325. It has first dollar coverage for drugs. So that is a plan. If I say, are you going to the doctor? Never. Okay, I know which direction to go. I have to go once a month. I go 8 times a year. Then I'm probably going to look at maybe a silver plan and say this might be best. And I can still make an argument for the bronze plan though, depending upon cost savings. I can still look at that and say, well, it's up to you. You know, you're in the middle somewhere here. You have to decide what you think you're anticipating for next year. And you can change every year at open enrollment. So if you're anticipating a surgery and you look at the dollar cost, it might be better to move from one plan to another based on what you're anticipating your expenses might be. Okay, so.
Silver's cheaper.
Huh?
Silver's cheaper than
Well, silver's, they're gonna go from bronze being the cheapest to silver being the next and so on. Okay, platinum being the most expensive. However, in some instances, when you compare across the board, a silver HMO with health net could be cheaper than a bronze with Blue Shield. Just because of the networks are more diverse. I could say, well, if you're willing to go with a smaller network, I could get you into a silver plan for less than a bronze plan in some instances. It just depends on what's important to you. Your doctors, if they're not in the plan, it's not worth it to you, then you go that direction. Because the doctors and the hospitals drive the cost of those plans. You know, it's not an apple to an apple. It's like I said, there's many, many moving parts to this. So it really, I impress upon you to talk to somebody. And the most critical, and that's going to transition me into Medicare. Medicare is an animal unto itself. And it's a time when we're most concerned about getting our needs met in the healthcare industry. Because we don't know if we're going to have a heart attack tomorrow, come down with some rare disease, get a Lou Gehrig's. I've seen all kinds of things happen to my clients. And they were healthy when they started. It happens. Our bodies don't go forever. So it's really important that you choose the right plan that suits you when you're Medicare. And when you age into Medicare, you know, you're 65, and I don't know about you, but our brains are not as highly functioning as they once were. And I know it's a really sad reality. My daughter tells me, I told you that, and I'm like, I don't remember she even told me that. So, and I'm not 65 yet, so it's already happening to me. So I was telling you, I get it. I'm right there with you. So it's really important when you are making these decisions that you get all the information. And it's really difficult when they send you a book that's this thick, and it's a gobbledygook, bunch of foreign language to you because they use terms you're not familiar with and you don't use every day. So fortunately, people like me who are certified and trained, I can help you not read the mountain of paperwork that will confuse you want to help you. And you can rely on a professional to help you go through this process because it is complicated. But most importantly, what I always tell people is I'm going to make it simple for you. Just send me your doctor information, what hospital is important to you if you got ill, what are your prescriptions, I need the dosages and the frequency at which you take them, and then I use my software system to help me delineate what is going to be best for you.